coming today. My name is Anthony Catuzis. I'm an academic advisor in pre-professional advising, and I work specifically with the allied health science programs here. Three of the programs I work with are undergraduate programs, speech and hearing sciences, clinical lab science, and rehab services. But I also serve as advisor, secondary advisor for students that are interested in PT, PA, and OT. So that's the reason why we're kind of having this workshop. You know, what we want you guys to gain from this workshop is just have a good, a strong perspective of what the field of PT is. Learn more about it, dig into it. If you haven't really thought about it as much, and this is your first exposure to it, we certainly want it to be a wealth of information that will kind of help you maybe determine, is this something that I want to do with my career. It's a great program here at ECU that we have, a lot of good programs in the state as well. And so, just introducing myself and kind of what we do in advising, I'll direct you guys to our website. I gave you all a magnet. On that magnet, tells you what our website is. I strongly encourage you guys to visit our website, ecu.edu/ppac, really easy to get to, and register with us. When you register with us, you'll receive, on a first-hand basis, any information that we're having on workshops that are designed to, it might be one like this that helps you learn more about PT. It might be something else about graduate school. It might be more about taking the GRE. Any kind of workshop, if a graduate program and specifically PT are the goal, that's what our programs are kind of targeted to do, is to help you guys get there. So just kind of after showing you our website, give a little plug there. I'll let you know that we are videoing this, and so the video is going to be posted on our website as well. So if you have any friends or other PPT club members, anything like that, if they missed out today, tell them they can visit our website and check out the video. I believe it's going to be actually linked to a YouTube channel. So. And then make sure you also check out our ECU's PT page. Really simple to get to, ecu.edu/PT. A lot of great information there. Dig in and learn a little bit more about our program. So I want to go ahead and introduce Dr. Hilary Bauer. Hilary is a PT with Vidant, and she is our speaker tonight. Thank you. And the floor is yours.
All right. Thank you all very much for coming. Thank you for having me. Like you said, my name is Hilary. I went to undergrad at ECU, and I also went to grad school at ECU, so I'm a pirate all the way. I graduated from undergrad in 2008, and about 7 days later started grad school. The grad school program here starts in May, and it's a 3-year program. So I graduated in 2011, and I started working at the hospital shortly after that. Okay. When I was in undergrad, I didn't really have many opportunities like this, even in the grad school, and even after I started working, I really didn't have a very good understanding of the different types of places that were available to work as a physical therapist. I kind of grew up and playing sports, got hurt, went for PT, and I thought that there wasn't much more than that. Anyone else have a similar experience? So injuries, outpatient PT? Yeah, okay. I'm originally from Winston-Salem, but I really like the Greenville area, so I kind of stayed around here. And again, like I said, I grew up playing sports and hurt myself, and that's kind of how I got into the field of physical therapy. My undergraduate degree is in exercise physiology, so any other exercise? Yeah, excellent. Okay.
Large portion.
Yeah. If you guys do have any questions throughout, please feel free. Just go ahead and ask. Pretty informal. Okay. One of the requirements to get into PT school is that you have to do some shadowing time, some volunteer time. The ECU program is a minimum of, I think, 100 hours, and I did mine in an outpatient clinic in Winston-Salem, and that was great. We have some really good opportunities through the hospital for shadowing, volunteer time, to kind of see, what we get to do on a daily basis. And you'll be able to really get some hands-on experience. Whoops, because we will put you to work. All right, okay. I made a little PowerPoint. I want to go ahead and put these up here. These are some pretty good resources. Now, besides the ECU physical therapy school website that also has a lot of good information on it, physicaltherapycareer.net is pretty good. It has a list of all kinds of things. Like, it has a lot of information on PT in general, salaries by state, like average salaries. So I thought that was pretty neat. This is the North Carolina Physical Therapy Association website. That's also a pretty good website. They have a lot of links for, again, what it is to be a PT, education opportunities, and stuff like that. The American Physical Therapy Association is probably going to be, I would imagine, the best resource as far as getting really accurate numbers for salaries for PTs, and I did pull some of those numbers I can share with you because this really is covering, again, the whole U.S. And then the North Carolina Board of PT Examiners, this is the group that's responsible for providing the licensure exam. So pretty big deal. So that was just kind of more, FYI. They do have some information there as well, but the first three, I think, are the best. If you do want to, come check out what we're doing at the hospital, the guy that we work with who really works closely with our students, his name is Glenn Newman, and you can email him gnewman@vidanthealth.com if you do want to come, and we welcome students. Again, love having students come and work with us, and we will put you to work. Okay. Okay. All right. Well, let's talk about some of the differences between physical therapy and occupational therapy, and then I also added athletic training, because sometimes one of the common misconceptions about physical therapy is that we just work with athletes. Well, that is definitely not true. Actually, a vast majority of physical therapists in the U.S. do work in hospitals. Now, I work in acute care, so I'm going to talk more about the different types of settings. I work primarily in the heart center. I work with patients after heart surgery, lung surgery, vascular surgery. So, if someone has an infection in their leg and they have to have an amputation, I'll probably be the first one in getting that patient up, moving around. We have a trauma floor. Trauma is always very, very interesting. Those are always the most interesting cases. We have an orthopedics floor, so you have your standard hip replacements, knee replacements, but I have worked with athletes before in the hospital on the orthopedics floor, because if you have an athlete that, breaks their leg in whatever sport and they have to have some kind of surgery on it, well, they're going to be in the hospital for a little while, and physical therapy is going to come in and help progress them towards discharge. Okay. So with physical therapy, we're really looking at movement disorders. We want to look at mobility, neuromuscular, all kinds of stuff. We're really trying to restore function. We're trying to improve mobility. And we work with pain relief. And we also like to prevent or limit as much as we can any kind of permanent disability. Okay. With occupational therapy, and sometimes the name can be a little confusing because you say occupational therapy, I'm 90 years old, I'm not working, what do I need occupational therapy for? The way that the OTs that I work with will describe occupational therapy, it's not your job, it's your occupation of living. Okay, so OTs are going to work very closely with PTs, especially in the hospital. Okay, there is a lot of overlap between what we do. All right, with OTs, they're really going to be working on modifying someone's environment, working with adaptive equipment, like if a patient has a spine surgery and they can't reach their foot to put their socks on, an OT will come in and bring them some different pieces of equipment to help them, do that kind of thing. So they're really going to work a lot on dressing and bathing, grooming, kind of those day-to-day tasks. With physical therapy, that is also something that we look at, But if I go in, I'm looking at like balance, I'm looking at strength, you know, can they not get down to their foot because they lack the strength in their hip to bring their leg up and stuff like that. OT also is going to work on a lot of fine motor skills, and they do a lot of cognitive things too. Athletic training, really, athletic trainers are going to be the people that are working with athletes, and a lot of times they're going to be working with athletes before a physical therapist would. Athletic trainers, you can think of kind of you're on the field, you know, all the time, kind of first responders, stuff like that. One of the differences between athletic training and physical therapy as far as education is that you can go to school undergrad and get, you know, a degree in athletic training, 4-year degree, and then take a licensure exam. Physical therapy is going to be a graduate program, so you're not going to find any undergrad PT programs in the United States. But a lot of times people will start out in athletic training and kind of use that to get into physical therapy. There was a guy in my class who was an athletic trainer and decided that he wanted to do a little more, so he went to PT school. So let's talk about school a little bit. There are 6 schools in North Carolina for physical therapy. Okay, they're all doctoral programs, and that is within the past, I think, year or two. They were a master's program. The American Physical Therapy Association has this thing that they call Vision 2020, and it is pretty neat. It is something that would be good to look into, especially if you have an upcoming, you know, PT school interview. You know, really utilize these resources and find out a little more about what that is. All right. Basically, what that is that they want all PT programs to be doctoral programs in the U.S. by the year 2020. And so North Carolina already has that done. So that's great. So the schools are ECU, obviously. Chapel Hill has a program. Winston-Salem State has a program. Western Carolina, Elon, and Duke. Elon and Duke are both private schools, so you're going to be looking at paying more money. The other ones are public. Does anybody want me to repeat any of those? Okay. These are all accredited programs, all right? That means that they did a lot of work to make sure that they have a very, very good program. So that's a pretty big deal, okay? You have to have at least a bachelor's degree to get into PT school, and you also have to take the GRE, all right? I was not a big fan of the GRE, to tell you the truth. I thought it was like the college version of the SAT. I didn't like the SAT either. But my scores were good enough that I got in, luckily. Okay, so any questions so far on that type of thing? And I can tell you a little bit about the ECU's program. Again, like I said, it is a 3-year program. You go to school year-round, so it really is 9 semesters of school, which is great because you're there for 3 years instead of like 4.5. All right. So if you want to go to PT school, for our program, you would be starting in May and you'd be graduating in May. Okay. In PT school at ECU, you do 4 clinical rotations. It's kind of like doing an internship. Actually, right now I have a student with me at the hospital who's doing a 6-week program. And basically what that is that's to give you experience in different areas so that when you graduate, you'll be able to start working wherever you want to work and at least have a basic understanding of how that area goes. All right. All right, so let's talk about the different settings, because like I said, you know, even when I started working, I honestly didn't even know that all of these existed. I even had to do a little bit more research on it after I started working, because someone walked up to me and asked me if this patient was going to sniff, and I was like, sniff? Like, no. So, outpatient. We're probably all pretty familiar with outpatient, all right? You know, again, you tear your ACL and then you have a repair, heal up for a couple weeks, and then you go to an office visit, kind of like you would go visit a doctor or whatever. You're going to work on a lot of stuff within the office And you're also going to be doing a lot of exercises at home. Okay. Acute care, which is what I do, that's going to be in a hospital. Now, in the hospital here, we actually have kind of different types of settings. We have acute care, so that's if you say you're in a car accident, heaven forbid, and you end up on the trauma floor. The first people that you'll be working with are going to be acute care physical therapists. All right. Now, say after that, you can't use this, one leg at all to walk. You can't use an arm to help you. You may need to go to like an inpatient rehab for more therapies. So we do also have an inpatient rehab within the hospital. It's technically a separate admission, all right? And with the inpatient rehab, you're going to be doing 3 hours of therapy a day between 2 disciplines. So for a lot of people, that's going to be PT and OT, okay? So there's not really going to be much crossover. So once you're discharged from the hospital to inpatient rehab, you wouldn't be working with the same physical therapist, okay? We kind of share a common area, but you probably wouldn't really see us very much, okay? And that was something that I didn't even know. Like, I showed up for the interview, and I interviewed with 6 different teams, and I didn't know who was who or what was going on or even what I was interviewing for. I knew that I liked acute care and cardiopulmonary, so that was the position that I accepted. But they do have different divisions of inpatient rehab. So they have kind of your general rehab, inpatient rehab. There's also a spinal cord injury unit. There's a brain injury unit. There's a pediatrics rehab unit, which is actually where I did one of my clinical rotations. So that was probably, to be honest, that was the most challenging one that I did, because I worked with kids from 0 to 18. So that was considered pediatrics. I will go into specialties a little more. I know a lot of people are interested in a particular specialty in PT. Let's get through the settings first. So, yeah, acute care. So again, your grandparent has a stroke and is in the hospital for a while, and then they may transition to inpatient rehab. Okay. Another place is, we call it SNF. It's SNF. Skilled nursing facility. Skilled nursing facility kind of is a little bit of a bad rap, because that's a lot of times what people will think of as a nursing home. And there are a lot of amazing facilities and there are a lot of bad facilities. And the bad facilities are what everyone knows about and why no one ever wants to go. But there are some really good places, even in Greenville. Because sometimes patients, especially patients that I work with, cardiopulmonary patients after heart surgery, may not be able to tolerate 3 hours of therapy a day because it would be too taxing. So perhaps that patient might go to a skilled facility for a while. They'll still be receiving the medical care that they need, and they'll also be doing continued therapies. Sometimes people are also doing too well to even go to inpatient rehab. A lot of times inpatient rehab folks are needing a lot of help to stand up, to walk, Well, sometimes patients, like a lot of the patients that I work with, they're able to stand up and walk, but they only need a little bit of help, right? But they can't go home because they live alone. And if they can't stand up by themselves, then going home is not necessarily the safest option right away. So they may need to go somewhere for some more therapies first. In acute care, my goal is to get the patient to the next level of care, whether that's home, skilled, inpatient rehab, wherever they may need to go. My goal is to get them there as quickly as possible, because you can't hang out in the hospital forever. We have a very high volume. I stay very, very busy. We're trying to get people in and get people out. The longer that you stay in the hospital, the more likely you are to get some kind of infection. We take great measures to make sure everything is really clean, but in a place that big, it is very, very difficult. Okay. There are home health physical therapists. So this is your patient that has a, knee replacement, all right? They do really well. They have someone that they live at home with, but maybe not getting around very well right away. They're doing well enough to go home. Physical therapists could come into their house and work with them on exercises, on range of motion, all kinds of stuff to make sure that, they're getting the therapy that they need, and then they will probably transition to outpatient. All right. So there's not always just one level, you know, you can go through multiple levels. Sometimes patients will go to inpatient rehab and then they're just not doing well enough to go home yet and they can't stay in inpatient rehab anymore. So maybe sometimes they'll transition to a skilled facility for a little while. So a lot of what we do is help problem solve to figure out what's going to be the most appropriate for this patient. All right, because patient safety is our number one concern. We want to keep people out of the hospital. Hospice is another. There are hospice facilities. There's also home hospice. That's generally going to be when someone is getting a little closer to end of life. So a lot of times those patients can work with physical therapy for mobility, a lot of times pain relief. That is probably, I would imagine, a little bit of a smaller field compared to the ones that I did just talk about. School PTs. A lot of schools do have physical therapists that come into the school and work with children, especially children that do have special needs like cerebral palsy, so they're having issues with mobility, getting back and forth from class, stuff like that. There are also like industrial or workplace physical therapists. I think that is also kind of a small field, so maybe a huge, I mean, I bet Google has, you know, a workplace PT for their, you know, their employees with neck pain, I guess, but I don't know a whole lot about that one, to be honest. Education and research centers, so a lot of the PT school professors are still practicing physical therapists, but they're also working in education. Or doing some kind of research. And then you can have physical therapists that work in fitness centers or like training places. Okay. Questions about, especially like acute versus inpatient rehab. I know sometimes it can be a little fuzzy. So, inpatient rehab can also involve aquatic therapy. There's really all kinds of stuff. The inpatient rehab facility within the hospital really is very neat. They have some very, very cool technology, and I do have some things that I can show you, some of the things that I do on a daily basis, and then some of the cool toys that they have in inpatient rehab, because they got something within the past year that's a pretty big deal for our hospital. They also have this thing within their facility called New Horizons. And they have like a car in there. They have like a little grocery store set up. It's like a bank. You walk in and there's like a sidewalk and a stoplight. So it's really working on the things that we want to work with physical therapy in a really, really functional setting. You know, going up and down the curb, getting in and out of the car, putting gas in your car, grocery shopping. So that's really neat. I definitely would encourage you, if you do get a chance to, you know, come check out the hospital, to definitely look into that. Okay. All right, so let's talk a little bit about specialties. So say you're a physical therapist and you're done with school and you want to work in an outpatient. Well, you know, you're going to be working for a while, but then maybe you'll have something that you want to do as a specialty, all right? And a specialty can be a certification. And it's going to require a lot of work, a lot of continuing education courses, and for some of the, actually all of the specialties, they do also have an exam that you would have to take. So if you become certified in something, it's a big deal. It looks very, very good on a resume, and it makes you very hireable, because you're going to have the experience, a lot of experience in this field, because you've gone through hours and hours and hours of education. The specialties, if you do have more questions about them, you can look on the American Physical Therapy Association's website. All right, they're going to have the list. All right, one of the specialties is cardiovascular and pulmonary. So now, even though I work in that field now, but I am not specialized in that. I didn't take an extra exam. I have taken several courses, and that is something that I would like to do eventually, but this is something that's going to take a while. That's not anything that just happens overnight. You want to get experience and do all this extra education. Another one is clinical electrophysiology. All right, so you can do research for eSTEM, all kinds of stuff. Okay, geriatrics is another one. If you really are interested in working with the older population, neurology, orthopedics. So a lot of times PT is working an outpatient will specialize in orthopedics because that's really what that setting is designed for. Pediatrics, sports, physical therapy, and women's health. So those are the ones you get a specialty certification in. I mean, you can decide that you're interested in pretty much anything. There's a lot of different opportunities to find your niche, find what you really want to do. All right, let's talk a little bit about salaries, because I know that is the question on everyone's mind. All right, I really wanted to see if I could find it and break it down by which setting you're in, but unfortunately my search did not yield the results that I want. So I have the median salary for PTs in the U.S. All right, so how much you make is going to depend on several different things. It's going to depend on how much experience you have, what city you live in. All right, so a PT in New York City is going to make a lot more money than a PT in Tarboro. All right, but you got to factor in cost of living too. It's going to cost a little more to live in New York City. All right, so location is definitely a big thing. And another one is going to be the setting. Okay. I think one of the things that I didn't really touch on a minute ago was traveling PT. So a traveling physical therapist is going to be someone who works for an agency, and that person is not necessarily working at the same place all the time. Okay, they could be working in a hospital for 6 weeks and then going to a skilled facility for another 2 months, and they're going to be going kind of all over the place. All right. So that's a good field. Those are the physical therapists really that are going to be making a pretty good amount of money. All right. That's not anything I would ever recommend doing right out of school. You really need a good basis of knowledge, and that is also a very stressful job because you really don't get a whole lot of orientation time. You kind of get thrown into a hospital. Okay, these are the patients that you need to see. You need to know how to see them. So very, very stressful. I never recommend doing that as a new physical therapist. Bad idea. Okay, so the average salary for a physical therapist in the United States is going to be about $80,000 a year. All right, and the source for there is from the APTA website. I can tell you right now, I am not making that much money right now. Okay, again, that's going to be factoring in traveling PT who makes a lot of money to, I don't even know what the lowest, to be honest. That's why I wanted to find it, but I couldn't find it. So that's going to be the average. Okay. And it didn't say that if that was starting salary, but there's a lot of room for advancement. So, okay, so also, so if you're kind of questioning, all right, well, what's the difference between a PT and a PT assistant? All right, because I'm going to talk about the PT assistant salary as well. So a PT, the average salary for a PT in the U.S., like I said, is about $80,000 a year. All right. The average for a PT assistant, according to the APTA, is going to be about $46,000 a year, and that is also going to be, traveling home health, like across the different settings. Okay. PT assistants are absolutely vital to what I do, just because we have a very high caseload. So if I had to do evaluations and treat every single patient that I evaluated, I would never see all of my patients. A physical therapist is going to do the evaluation, examination. We make the discharge plans, recommend different equipment, stuff like that. The physical therapist assistant is going to help carry out that plan. All right? So they're going to be working on, in my setting, working on gait training, bed mobility, different exercises, stuff like that. PT